Welcome to Kitchen Table Finance, the podcast where we serve up bite-sized pieces of financial advice to simplify your money and your life. Join your hosts, David Shotwell and Nick Nauta, and let's get started.
Hey, Dave, how you doing today?
I'm doing great, Nick. How are you?
Doing well. We've got a doozy, if you will, of a topic today because you and I are going to attempt to explain health insurance for Michigan State retirees. And I say doozy because, full disclosure, neither one of us are health care experts or insurance experts for that matter. But we do kind of understand the basics of how that needs to be thought about in terms of your overall retirement plan and functionality, but maybe not the specifics of what different plans cover and how they're covered and what that means to you. So full disclosure starting out today, Dave.
Yeah, full disclosure is always the best disclosure, right? And, and I would add to that even though like you'd think it'd be like a simple thing to talk about a specific health insurance plan, there are so many variables depending on someone's circumstances here that it's really like boiling this down to like a set of rules is nearly impossible.
Yeah.
So,
and I think just from the retiree's perspective, if you're thinking about retiring, just knowing, because this is, one of the most confusing and one of the things that's changing so fast that it's really hard to kind of make a concrete plan of like, I know my insurance will be X for the
you mentioned that like while we were preparing, like we've got it, like as soon as we like publish this, they'll probably change all the plans. And in addition to that full disclosure, I guess the thing that goes with that is we can talk in broad strokes today. We can talk about the philosophy behind the decision making. That's probably not going to change.
Yeah.
But when it comes time for you as a retiring Michigan State employee to figure out your health insurance, that's the time to like really say, okay, what am I entitled to based on when I was hired and when I'm retiring and how long I've worked and, what are the plans today?
Well, and I would say too that one of the reasons why it's so complex is because there's a lot of options available, and that didn't necessarily used to be the case either.
Right.
And so I think for a lot of people that's a good thing, but it also brings complexity into the decision-making process of what age you're going to retire, what your health insurance is going to look like. A lot of companies have gone away from offering retiree health insurance. So the good news for our Michigan State folks is there is a plan in place. And so you do know, like when you retire, there's going to be a healthcare plan that you can participate in.
Right.
Devil's in some of the details of how that will work for you in your specific situation. But the good news is, there's health insurance that you can be a part of.
Yes. So, okay, enough disclaimers. We should get after it, right?
Yeah. So I think there's, I like to start this conversation for most of my retirees with kind of the major transition decision points, right?
Yes.
And so the first one is, are you going to retire before 65? And why is the age of 65 important, Dave?
Well, that's when you're eligible for Medicare.
That's right.
Yeah.
So we're going to talk a little bit about Medicare, but most retirees, obviously, if you've worked and paid into the system, will be eligible for Medicare. And so at 65, basically everybody has, universal type health insurance for people 65 and older.
Right.
But if you retire before then, you have to start thinking about what kind of coverage am I going to have and what does that look like from a cost perspective. If I want to retire at 60, that means I got to figure out what the next 5 years look like before I get on Medicare.
When we're working with pre-retirees, it's interesting the preconceived notions people have about that and come into the office often with the idea that I cannot retire until 65 because I need to be eligible for Medicare first.
Right. Yep.
And so we usually look at it as, let's set this up as a goal for spending in retirement that changes based on when you retire, but let's not preconceive that idea that you cannot retire before Medicare eligibility.
Yeah. So let's unpack that a little bit, Dave, because there are some different, especially for our MSU people, there's a couple different options that you're going to have when it comes to retirement before 65. We talked about it or alluded to it a little bit, but you're going to have the MSU health plan eligibility.
Yes.
And we'll talk a little bit more about what that means. But if you meet the eligibility requirements, you do have a health plan that MSU provides, and depending on those requirements, you may or may get some sort of contribution from the university, right?
Yeah, that's really what it comes down to. Is if you retire before Medicare eligibility, you will be on what MSU non-creatively calls their non-Medicare plan
Right.
for retirees. And what really varies is how much of the premium you would be responsible for versus how much of the university coverage you get for that cost.
Right. Yep.
And there's really no easy way to nail that down other than, if you've worked there a long time, you'll have more of the premium covered by the university. I think that's a pretty fair way.
Yeah. Yep.
And the more recently you were hired, the less they will bear the cost and the more it will be up to you.
Yeah. And we'll throw a link in the show notes to the current policy of retiree benefits that are from the MSU website. But without getting into and we can talk about that a little bit, but I think you nailed it, Dave. Like if you've been there for a long time, chances are you're going to get a contribution from the university.
Right.
The shorter you've been there, the less money or maybe no money at all you'll get from the university.
Right.
So which just means you'll have to pay the premiums.
Right.
Another thing that I think people forget about a little bit too is COBRA coverage. You want to go over that?
Well, COBRA basically is the ability to continue your health insurance that was provided by your employer while you were working for a period of time after retirement without having to prove eligibility or do any background stuff. The trick is that you are then responsible for the premiums entirely, whereas while you were working, a lot of that cost was borne by your employer. And so while it's been pretty rare that that's been the better option for most folks, that is another tool that's out there if you retire before Medicare age, is you can look at continuing your current coverage.
Yeah, especially for people who are, because COBRA coverage is 18 months. I think is the longest you can go.
Months.
So you'd have to be, after 18 months, you'd have to have some other form of coverage potentially.
Right.
And like you said, when you look at all these options, that's usually kind of the lowest one on the list, but certainly something that you want to evaluate and think about, because we do have on occasion, not from Michigan State, but people who have taken COBRA coverage as kind of that gap.
Yeah, it usually comes into play with employers that do not have the benefits package for retirees that Michigan State has. That's probably going to always be the better choice, but it is out there. It also used to be a bigger deal before the ACA.
Right, correct.
That was a fallback position. If you were going to retire at 65 or before 65 and didn't have a plan like Michigan State has, you either needed to make sure you were insurable, healthy enough for a plan to take you in the private marketplace, or make sure you were in that window where you could continue COBRA coverage for the that period until you were Medicare eligible. That's kind of not a big deal anymore with the ACA marketplace plans.
Yep. So the Affordable Care Act it's kind of created this health insurance marketplace. And one of the big things from that standpoint that it changed was there's no if you have a pre-existing condition, the insurance company still has to cover you. So you're not excluded from getting insurance because of a pre-existing condition. which, if you are 62, 63 and thinking about retiring, a
That,
lot of people have some medical conditions as a part of that could potentially cause problems with your ability to find coverage. And that's
yeah,
just not the case anymore.
yeah. So it's not nearly as scary as it was, 15 years
Yeah.
ago.
Right. So now the hard part is you again are responsible for making or paying the premium from the marketplace plans. And I know we've done some podcast episodes on this before, and this is the one that's always changing. You've heard about it in the news quite a bit, but depending on how much income that you have will depend on if you get what is called a premium subsidy from the government to help you pay
Right.
for your insurance. A lot of that has gone away for people that are making more than, oh boy, I think it's like 84,000 or so. Don't quote me on this. Again, not my level of expertise, but if you're making a decent amount of money, you're probably not going to get any help from the government when it comes to
Yeah.
paying these premiums. Let's put it that way.
Whatever you qualify for, if you're a Michigan State employee and you're going to have part of the premiums covered by your employer, or if you're doing this on your own, or if you're a recent hire and don't have a lot of the premium being subsidized. One thing that I think is an interesting psychological bit back to how people think about this in retirement. Remember, that's usually only for a few years before Medicare
Right.
starts.
Yep.
And that back to that, like, gotta wait for Medicare to start because I cannot afford, health insurance premiums. Well, you and I, like, we worry about the expenses that go from like age 62 to 92,
Right.
but an expense that only goes from age 62 to 65 is probably not going to be a deal breaker for most people in terms of
Yeah.
when they can retire. So,
Yeah, and I think it's one of those where, I mean, the obvious thing as you're thinking about this is what's the risk level, right? So,
yeah,
like if you're going out to the marketplace and that changes, that's kind of a risk that you're bearing before
right.
65. And so, it's one thing, like you said, if you're 62, it's another thing if you're thinking about retiring at 50, because then
Hmm.
you got
Yes.
15 years of
Yeah.
potential changes. So you're
Yeah.
taking on more risk that system changes and doesn't work in
Right.
your favor anymore.
Right.
But the nice thing for our Michigan State folks is if you have a plan, even if you're paying for it, those group plans have been a lot more consistent in terms of, yes, they've gone up in price, but they've been a lot more consistent in terms of availability and
Right.
eligibility.
Yeah.
And you might feel a lot more confident knowing that you have that plan that's been around for Michigan State retirees for a long time than trying to go into the marketplace, which is relatively new and changing quite frequently, especially as of late, so to speak.
Right. Right.
We would be remiss if we didn't talk about the fact that there are some lucky folks out there who have spouses that maybe are covering them in healthcare. So if your spouse is still working and you're covered under their plan, you're probably fine.
Yep.
Or if they have a retirement benefit of their own that, their former employer is paying your coverage or cost as well. That's another kind of potential
True.
benefit outside of this. So those
Right.
are few and far between these days, like we talked about. So consider yourself lucky if you're in one of those situations, like I
Yeah.
guess, but certainly something to think about. With that, Dave, I wanted to talk a little bit about Medicare.
Yay.
Was that a groan for talking about Medicare?
I'm sorry. I'm sorry. Yay, Medicare.
And we've done a couple of discussions about Medicare with our friend Justine from Benny Guides, although we probably should have her back on for a refresher because some of the stuff is changing as well. But the basic tenets have not, and that is there's several parts to Medicare, but the big ones are Part A, which covers hospital costs, Part B, which covers medical costs, and Part D, which covers prescriptions. And then also, as an MSU employee, what happens when you transition from before 65 to 65 is Medicare all of a sudden becomes your primary coverage. And then the university policy is kind of that backdrop of, you know, covering either, typically in the supplemental world, it's either a Medicare Advantage plan or a Medicare supplemental plan or a Medigap policy. And your MSU plan for most people would cover kind of those gaps of, which
Yeah.
is essentially there are parts of your medical coverage that Medicare won't cover. And so those supplemental policies will cover that. And the university plan will kind of stand in to cover those for you as a retiree if you're eligible.
Right.
Anything you'd like to add to Medicare, Dave?
Oh, yeah. I guess technically the Michigan State plan is a Medicare Advantage plan,
Okay.
and
What we can say is Justine did a fantastic job of explaining those differences. So if we will put a link to that webinar in our show notes,
good way
because
to
I think
handle
that's
it.
super helpful. But just know that, I guess the big thing is when you turn 65 and transition to Medicare, there's some things that you have to do because there's some penalties if you don't do them on
Right.
time. And B, that's going to be your primary insurance, where the Michigan State insurance is going to be kind of your Medicare Advantage plan to cover anything that Medicare doesn't.
And you're expected to enroll in Medicare Part A and Part B.
Yep. And it's another, and I guess what I would say about all of this too, like if you're retiring before 65, if you're retiring at 65, like if you, it makes sense to go out and gather information in terms of this is what I have from the university. This is what I can go out and get on the marketplace or wherever and make that decision of kind of what's going to be the best option for you. And where you and I come in and kind of how this plays a role in people's retirement planning is if you gather all the information, we'll help you go through and identify the potential risks and also identify the costs and help you make a plan
Yes.
for which one of those options is going to be the best for you in conjunction with, because this again, like the details of the plan are our specialty, the costs and things are. And so like figuring out based on your health level, what kind of coverage you need, prescriptions, like working with someone to help you figure out like what these plans are going to cover and what might be the best fit for you.
Right. Right. And the pros and cons of planning
Right.
to pay through the insurance versus,
Right.
building in the possibilities of other expenses that you don't have coverage for.
For sure. We kind of alluded to it before for the MSU Retiree Health Plan, but there are some different eligibility requirements for that, like we talked about. And I think the best thing to think of there is to contact, when you get close to that, contact HR and have them walk you through what you're eligible for and what your premiums would be as that kind of information gathering. But there's, different, depending on when you started or how long you've been there, will depend on how much coverage or how much money the university contributes towards your plan. With that, there are some potential planning issues and maybe even some things to think about from an opportunity standpoint. One of the things that gets thrown around quite a bit is something called IRMA. You want to explain what IRMA is, Dave?
Oh, yeah. So IRMA relates to your income and the Medicare Part B premiums that you pay.
Mm-hmm.
And I think the easiest way to think about it for most people is it's additional tax that you owe on income based on what your income was the year. What are we looking at? 18 months back, 12 months back.
Yep. Mm-hmm.
And so things that you do in 2026 are going to affect your future IRMA brackets for what
Right.
you pay for Medicare Part B.
Mm-hmm.
So there's planning opportunities. We basically have to be cognizant of how that's going to impact your Medicare Part B when we make decisions around Roth contributions, IRA distributions, 401k income, things like that.
Mm-hmm. Yep, there's a couple things that kind of catch people occasionally, right? So if you're working past 65 and you make a decent amount of money, you might be in a situation where you are above the IRMA threshold. and then you go to retire and your income is changed. And so there is a form that you can fill out to say, hey, I retired. I don't really make that much money anymore.
Right.
And people sometimes forget or neglect to do that and end up paying more for the insurance that
For the first year.
they shouldn't necessarily have to. So that's one thing to think about. Another kind of planning issue or opportunity as well is just HSA funds have become more popular now. And so a lot of people have been putting money into health savings accounts. I always kind of nerd out about health savings accounts. And I think people laugh at me because I'm like, oh, they are the coolest thing on earth.
Yeah. They're like the most generous financial planning tool that Congress ever created. Yes.
Yeah. So the main reason for that is the triple tax benefits, right? So you put money in and you don't pay taxes on it when it goes into the account. And then when you take it out, as long as you take it out for a health related qualified expense, you don't pay taxes when it comes out either. So that's two different tax benefits. And then the third is if you can roll those funds over every year. And so if you're investing and gaining interest on those, and that interest is compounding, you're not paying taxes on that growth either. So really cool for super nerdy financial planning guys like you and I, Dave. People might be rolling their eyes right now at how cool I think that is. But the reality is, if you have these funds and if you have saved and invested them over time, now is kind of that opportunity where you might start to utilize some of those funds as a part of your overall strategy when it comes to healthcare expenses. And there are certain things that you can and can't use them for. So you got to make sure that you kind of pay attention to the rules, but that might play, a significant part of how you cover some of the medical costs when it comes to retirement.
For sure.
So we got a little case study going on to kind of wrap us up here, Dave. We've got Jane, who's 63, retiring in June. And so what happens is the first thing that we have to do, right, is what we talked about, is just kind of evaluate all of Jane's options.
Right. Yeah. Talk to human resources, find out what share of her premiums will be covered by the university versus out of pocket, so that we can build that expense into Jane's financial plan.
Yeah. And depending on how long, if Jane doesn't have enough years of service where she qualifies for Michigan State's contribution towards her retirement plan, she might decide to go out to the marketplace. And one of the things you got to be careful with in the marketplace is how much income that you have. Because we've had situations where people either thought they were going to have less income than they ended up having and got premium subsidies that they had to turn around and pay back, or they made the mistake of doing a Roth conversion or something along those lines that actually increased her income for the year and ended up causing her to pay more for the insurance through the marketplace.
Right. So if Jane is going to be better off using coverage through the marketplace, we've got to be cognizant of what her income sources are going to be and how that's going to play with those premiums.
Yeah. And then the other thing that goes along with that discussion of Roth conversions is they also potentially have IRMA implications depending on how close you are to getting onto Medicare, right? Because they're looking back, is it 2 years before what your income is? So if you do a big Roth conversion when you retire at 63, because it makes sense, that might cause some potential issues when you turn 65.
Right. And you should note that sometimes it still makes sense to do,
for sure,
Roth conversions or otherwise, make income moves that are going to have IRMA implications. It's just important to know that ahead of time and know the cost before you do that.
Yep. I think that's a great point, because sometimes we get a little too wrapped up in the IRMA increase, right?
Yeah.
Like nobody wants to pay more for something if they don't have to, but sometimes it really truly does make sense to pay more for Medicare, knowing that you're going to save thousands of dollars in, 15 to 20 years from now, potentially.
Yeah.
So
That's why I prefer to think of it just as an additional tax.
Sure.
Separate it from an insurance premium that's deducted from your
Mm-hmm.
Social Security, because I think it's more of a psychological hurdle
For sure.
sometimes.
But I think your point too is valid in that you got to do the math, you got to do the calculations. And sometimes people just go willy nilly into these things and start doing conversions without thinking about what the ramifications are.
Right.
And if those ends justify the means, so to speak. And so you definitely want to run tax projections, see where you're at, see what that means if you're going to employ some other strategies that are going to change your income in a particular year, and how that can impact your, what you're not only IRMA, but also potentially marketplace insurance premiums. So with that, Dave, we've talked a lot about health insurance, but I would, in kind of like closing up as far as like an action checklist, if you're thinking about retiring or getting close to that point, obviously the first step is to confirm your eligibility for healthcare and what you would be eligible for, what your premiums would be. A lot of good information on the MSU website, but definitely reach out to HR and just verify all that stuff. You can request kind of a benefits estimate, which I think is a good first step.
Well, that's always going to be the best first step from my point of view, because it is so you're going to be wading through a lot of data and come away with more questions than answers probably, when you can just go straight to HR and have them do the math for you.
Yep. And then from there, it's just kind of a comparison. If you are looking at pre-65 coverage versus, what does MSU offer? What is going on in the marketplace? What does COBRA look like? And then also making sure that you are enrolling for Medicare on time,
right?
Because you don't want to pay penalties for that. And then, like we said earlier, running those tax projections, seeing what different strategy or where you're going to be from a tax standpoint in retirement, what kind of income you need, where are you taking it out of, what does that mean for the potential costs of insurance going forward.
I think you summed it up well there. It's everybody's least favorite topic in financial planning, but a necessary one.
Yeah, and I think it can be kind of scary and overwhelming, but there's a lot of good resources out there to help you through making that decision-making process.
Right.
One of the things that we're always doing in our retirement plans is accounting for those healthcare costs. We'd like to kind of separate that out from general everyday spending, because the reality is those costs are going up faster.
Yeah.
And just I'm making sure that we're accounting for that and adjusting for that and helping people make good decisions that make sense to them and their financial plan, and knowing and understanding what role that plays, I think goes a long way in terms of taking a lot of that anxiety out for people, so they have a good understanding of what health insurance looks like, what the costs are going to be, and how they're going to pay for them when they do retire, whether that's before 65 or after. Lots of different things go into that. So definitely do your homework, work with a professional, and you too can do this. You can get through it.
You can do it. You can do it.
Well, thank you, Dave. Always a pleasure.
Thanks, Nick. It's fun.
Thank you for joining us for another chat about your retirement and finances. Please hit that subscribe button. You can also contact us at srbadvisors.com or email us at info@srbadvisors.com. See you next time on Kitchen Table Finance.